We're following breaking news tonight on King 5 News at 5 o'clock. The CDC has determined the cause of a deadly mold outbreak at Seattle Children's Hospital, a hospital humidifier that had not been turned on for more than a decade. Good evening, I'm Mark Wright.
I'm Joyce Taylor. So it now looks like that could have been the source of Aspergillus infections that killed at least 2 patients at Seattle Children's since 2018 and sickened others. King 5's Chris Ingalls has been following this. You join us with the newest developments on this, Chris.
Well, we've been trying to get our hands on this record for a long time. This is the seven-page report that I got today through a Freedom of Information Act request that I filed a couple of months ago. It's not from the county or state health departments. We've been in a court fight with Seattle Children's for months to get that record through those local health agencies, but we got this afternoon directly from the Centers for Disease Control. And for the first time, it explains where children's deadly mold problem came from. Children's told the public last year that it believed Aspergillus mold was flowing through the ventilation system in some of its operating rooms. This CDC report gets more specific. It says a humidifier that was part of the operating room suite's air handling unit, AHU number 1, had been turned on for a short period before each of the 2 disease clusters. That's a reference to an Aspergillus cluster in 2018 where 3 patients were infected by mold, 1 died, and then again last year when several more patients were infected. Baby Elizabeth Hutt died from her infection earlier this month. The report goes on. This humidifier had reportedly not been used for over a decade previously, and the droplet size produced by the humidifier was too large for complete diffusion within the HVAC system, allowing for condensation. The report says moisture from the humidifier may have been trapped in this material, which could provide suitable habitat for mold growth. Mold that could then grow and circulate through the air handling system in the operating rooms. Now, I've sent an email to Seattle Children's asking why was this old humidifier, which was apparently shut off for years, suddenly turned on? No response from the hospital yet. The report delivered to the hospital in October also makes 6 recommendations that required immediate action. Things like testing for proper air pressure in the ORs and additional testing of the air handling units. Less than an hour ago, Public Health of Seattle-King County told me that it believes Children's has followed all those CDC recommendations, but the health department wouldn't comment further and referred our questions to the CDC.
Wow. So, Chris, what about the earlier cases? This is more recently specific to
2018 and 2019.
Yeah.
Right. But the hospital CEO told us, a couple months ago that this stretches all the way back to 2001, right? They've had Aspergillus cases since 2001 that they've all tied to the air handling system. So the answer to the question is this report doesn't specifically spell out whether they're going back that far. It's more concentrated on 2018, 2019 when there were the largest cluster of these cases.
Wow. So we don't know if that humidifier was being used in 2001?
I would love for someone to answer that question, and that is a question that we are asking now.
Okay.
More
Thanks,
documents
Chris.
possibly to come.
Yes.
Thank you.
Mm-hmm.